Hello, I'm Priya, and I just realized if I submitted my talk in advance, I would have a teleprompter to remind me when I forget my train of thought. So here I am, essentially winging it. A long time ago, I realized I was a deeply pragmatic person because my wife and I were talking about what the true marker of friendship was, and her answer was camaraderie. And my answer was whether or not I'd be willing to visit that person in the winter. I moved from Philadelphia to the Bay Area, and I know some of you are thinking, well, how does the winter stress test work in the Bay Area? And it turns out that you just become a wimp about weather, so now the real question is, will I visit you if the weather is under 55 degrees? My job, I am a doctor, and I'm the Chief Health Informatics Officer of the San Francisco VA. When I think about this talk, trust me, I am always reminded that everyone expects me to be a person who would absolutely attend this talk. But in reality, the pragmatist of me sees the title, Trust Me, and is initially trust me with a question mark. And I know that I would probably roll my eyes and not attend. The reason is because I see my job as needing to take these nebulous values like trust, and asking how, like that winter stress test, we can find a stress test, we can find a question that helps us decide whether or what the logistics are to enact those values into care. The question that you need to ask for trust is, do you trust your patients to answer the questions that matter in their care? When I was a resident, I'm going to start with a lighted example. When I was a resident, I was at a dog park, and a dog, unprovoked, bit me in the face. I was walking to get a tennis ball, I guess maybe that was provoked, and he ran up to me and bit me. I went to the emergency room at the hospital where I was completing my residency, and my colleagues in the emergency room ordered a standard battery of tests, one of which included a pregnancy test. Now, I am a cisgender gay woman who at the time was dating a cisgender gay woman, and the anatomy of our relationship was incompatible with an unplanned pregnancy. Thank you. I, of course, when offered that pregnancy test, said, I don't need it. I'm fairly confident. No. I'm 100% confident that I am not pregnant in this moment. And to my surprise, the nurse and my colleagues pushed back. They said, no, we really just need this for care. I'm sure you're not pregnant, but just let's knock it out. Let's get it out of the way. And I pushed back some more, mostly because honestly I'm a little bit cheap and my insurance wasn't that good. And at some point, after some tug and pull and tug and pull and tug and pull, I realized that I could either put my foot down, say no, and be what some would consider a difficult patient, or I could just get the test over with. That pregnancy test cost me over $200. And so when I ask myself, when I got to that moment, I asked myself a couple of things. First, what does it mean to trust your patients to answer the questions that matter in their care? And second, what does it mean to be a patient? Being a patient is a lot like being in this room with a caveat. I'm here, if I'm the patient, the spotlight's on me, but everyone in the room is a doctor, a nurse, a pharmacist, a social worker, someone who has their own microphone. And your microphone is much louder than mine. And so when I was sitting in that room, I asked myself, why was it so hard to say no? Why was it so hard to be difficult? As some of the audience members know, I don't hesitate to be difficult when it matters for my career, right? You don't get to be the 30-year-old that I am as a Chief Health Informatics Officer without bulldozing a few trails. Why was it so hard to say no when I was a patient? And I think the thing that you have to remember is that there is a power dynamic. Even when you're a doctor sitting in the room as a patient, the tables turn very quickly, where you're suddenly a person who people get to do things to, that people get to do things for. When I carried the angst of this memory into the rest of my residency, I realized that there are two types of doctors in the world. There are prescribers. Using the analogy of cancer, prescribers are people who know exactly the right chemotherapy, immunotherapy, radiation therapy, what have you, exactly the right therapy to shrink a cancer. They're asking themselves, what do I need to do for you? And that is a question that ultimately becomes indistinguishable from what do you need to do for me so that I know what to do for you, and a darker version of that question, to you. There are prescribers, and then there are physicians. There are people who understand that cancer isn't contained by the boundaries of a human specimen. That chemotherapy, sure, mechanistically targets that cancer, but really the treatment itself is intended for a person. And I know I started in the beginning telling you I was a pragmatic person, so you know that if I were in the audience, I would roll my eyes at that, but just bear with me for a second. Chemotherapy, at best, will prolong your quantity or quality of life. At worst, it will hasten your death or hasten your decline. And the moment that a doctor translates all that evidence into practice and says, this is what I'm offering you, whether or not you take that chemotherapy, that risk is yours. That risk is the patient's. They risk intervening and getting worse just as much as they risk not intervening and getting worse. You don't know what's ahead. And so when you ask that question of yourself, ask that question, what would it take for you to trust me to answer the questions that matter in your care? I want to tell you, the person who showed me the value of trust. I had a patient a long time ago. I'm going to cry. I'm going to call him Alex right now. Alex was actually my age. He continued to be the same age I was in the entirety of my residency. And we met in the hospital. He had awful lung and liver disease. Woof. Every time I tried to meet him, we followed each other into my primary care practice, he would get hospitalized yet again. And every time he got hospitalized, he would get stuck on a ventilator. He would get stuck for days. He would get stuck on the other end of a hospitalization where he lost yet another part of himself. And so when he, this young man, met me in my practice finally, I knew that there were dozens, literally, of doctors who were tweaking his medications already, who were trying to figure out, what is it that I can do? What medication change can I make to keep you out of the hospital? But that's not the question that mattered. If we really trusted Alex, we would ask him the questions that we were holding close to our heart and care. The question that mattered is, Alex, what do you make of your future? What do you make of all of this? And he said, I think something that is one of the most harrowing things I've heard a patient tell me. He said, my life feels like what it would be if someone donated their body to science while remaining alive. That every time I go to the hospital, a doctor tells me, just go on this ventilator, it'll turn things around. But I leave, as I said, on the other end, weaker. Within the span of a year, he was someone who could walk several blocks, go around a grocery store without even questioning it, to someone who couldn't get from the parking lot outside of my office to the front desk without getting short of breath, without having to pause. And so when I asked him about his future, he said, I know that I don't have years. I don't even know if I have until the end of this year. And I know one thing without a grain of uncertainty, that I have donated enough, that I am not going to die on a ventilator. But as I said, it takes something to operationalize that. It takes something to translate that desire into practice, because he had wanted that for some time. And yet every time he came to this spotlight where everyone else had the microphone, he would be convinced to just go with the momentum of care. It was easier to accept the ventilator than it was to question the people providing him the care. And so we signed a do not intubate order because he knew that if he suddenly died, that he would be comfortable with dying off a ventilator. And if he had gotten sick, as he had in prior times where it took a few days before he really, really got sick, that he would have time to make the decision. And he wanted a stopgap. He wanted people to stop saying and assuming that he was going to go on that ventilator. Sure enough, a few months later, I found 15 calls on my phone in the middle of a conference. And I left and talked to an ICU doctor. And Alex was there in the intensive care unit. Alex, who I mentioned, was on this stage looking at a bunch of doctors, and in the ICU in particular, doctors are surrounding you, 20 people in a room. He stood on this stage, and when that doctor said, just go on the ventilator, it'll only be a few days, he asked the question that I told him to ask them in that moment. He asked, is this going to reverse my disease? What is my life going to be like at the other end of this if I survive? And sure enough, that ICU doctor was calling me because they understood that Alex was done, that this isn't the life that he wanted. This wasn't the death that he wanted. He didn't want to slowly see himself chipped away at. He wanted to have some autonomy over his body in care. When you think about trust, the most important question to ask yourself is, do I trust my patients to answer the questions that are important to them in care? If you really find yourself wanting to operationalize that, you need to make sure you tell people the questions that you're asking yourself about their care. What is your future? What does this mean to you? You need to make sure that you give them the power that you have, the power of a question to ask the person who they need to advocate to, the person who is standing in the way of their goals, of their values. And it's as simple as that. Trust is as simple as that. I know this talk would be stronger if I paused here, but I just want to take a moment, because this is my first time speaking publicly on behalf of my work here in the innovation ecosystem, to tell you that I learned how to ask the right questions in care, how to demand that we find the questions to ask and we stick to the important questions. The reason I'm here as an innovator is because I had people, in the order that I met them, Susie Shirley, Madison Kofi, Amanda Purnell, Cole Zanetti, Angela Gant-Curtis, Blake Anderson, and Charles Franklin, who didn't just hear me ask the questions that matter, they gave me the tools that I needed to change the answers. And I don't know what innovation is if it's not finding the important questions and paving a path for a better answer. Thank you.